Hello viewers, this is Dr. Hiya Agarwal from Neelkanth IVF, fertility consultant. Today we will be discussing IVF process in detail. When couples visit us for the fertility treatment and they are recommended IVF, they are clueless and they are thinking that what is this process and what all it includes and how much time will it take. So today we will be discussing the basic steps and what all the couple has to do during the process of IVF and how they go about. Once the couples decided for the IVF based on their baseline investigations, including ultrasonography, blood test, including serum AMH, and the semen analysis of the male partner, once they are decided for the IVF, there are certain other tests which are required to be done initially. That includes viral markers for both the partners, as both the gametes will be handled in the lab. Along with that, the blood sugars, hemoglobins are required for the female partner as they are planned for pregnancy. Once everything is suitable and ready for the IVF, we start the IVF process for the couple. In this process, first the female partner undergoes a process which is called as ovarian stimulation or ovarian hyperstimulation. During this process, the female partner is given injections, hormonal injections, for around 10 to 12 days for developing multiple follicles in the ovary. In the natural conception or every month, the female develops only one egg. But during the IVF process, we gave them hormonal injections in high doses to form lot of eggs so that to improve the success rate of IVF. After the stimulation, the female partner is given a trigger injection to completely mature the eggs. Once they are matured, after 36 hours of trigger injection, they undergo a process called as ovum pickup. During the ovum pickup, the female partner is given a general anesthesia or a conscious sedation to nullify the pain of the needle, which is being taken to along with the ultrasound guidance to remove the eggs from the ovaries. On the day when this procedure is done, the male partner is asked to provide the semen sample. Once the eggs are taken out from the ovaries, then these eggs are fertilized in the lab with the semen sample provided by the male partner. This semen sample is processed and then inseminated with the female eggs. Insemination can be in the petri dish, which is called as in vitro fertilization, in which the eggs and sperms are being released in the petri dish. This is done when the male count is around 10 to 15 million. But if the count is less than 5 million, then the male sperms are being taken individually with the needle and then injected into the female sperm by a technique called as intracytoplasmic sperm injection or ICSI. Once the eggs are fertilized, they are checked by the embryologist after 24 hours to see how they are developed. This development of the embryos takes place for 3 days, or they may be developed for the 5 days depending upon the condition of the embryos as well as the parameters of the couple, especially the female's age and the ovarian reserve. After the embryos have been developed, they are transferred back again to the uterus of the female partner with the process called as embryo transfer. In this process, the anesthesia is not required. The female is asked to lie down on a OT table, and with the help of a catheter, we insert the embryos inside the uterus. After the embryo transfer, there is no need of strict bed rest. A normal rest with 8 hours of sleep, good food and good habits, simple lifestyle can improve the success outcome. After 2 weeks of embryo transfer, either pregnancy is confirmed by either a blood test or a urine pregnancy test. Usually a blood test is recommended. This is a complete process of the IVF done in general. If there are any queries regarding the IVF process or fertility opinion is required, kindly contact the number given below or visit our center. Thank you.